All right, it's just about 1 o'clock. It looks like our numbers are starting to hold steady. So we'll go ahead and go through some logistics and then get the webinar underway. Welcome. For those of you who don't know me, my name is Emily Dropkin. I'm the Senior Specialist for Research and Policy at the National Head Start Association. We are so glad to have you with us today. You can see on the screen how many organizations have been involved in planning this and are invested in the new partnership. And they represent such an exciting opportunity for child care organizations, for early Head Start organizations, for the entire field, and we're thrilled to have you with us. A few logistics as we start. At this point, you should be able to hear, and you can check your audio tab and call in through your phone lines, although those of you who can hear my voice can already or have already done that. At any time, if you have a question, you can type it into the question interface on the right side of your screen. We'll do our best to answer the questions all at the end of the webinar and try to get to the most commonly asked questions, although certainly we welcome all of your questions and all of your comments. The webinar is being recorded and will be available later. As we get started and as we wait for the last handful of folks to join us, we have a couple of polls to give you a sense of, and to give us a sense of who's on and to get ourselves ready. You should see the first on your screen now. We'll give everyone a few seconds to respond to that. All right, thanks everyone for voting. I'll close that out and let you all see for a second. It looks like we've got a great mix of people. We've got about a third of our folks from family child care, another 25% from Head Start, 15% from center-based child care, a handful of pre-K folks. Glad to have you with us, even if we're going to talk a little bit more about babies today. And then some other programs, and interested to hear from all of you. The other question that we have as we approach this conversation today is whether you're currently involved in partnerships between some sort of child care organization and Head Start or early Head Start. Even in Head Start, there is a mix of who's involved and who isn't, and I know that's the same in child care, so this will give us a sense of who's listening in. Right. Okay. And most folks voting, I'll go ahead and share that as well. And so what we see is that about a quarter of you do have partnerships already, and about 3/4 of you don't. So we'll look forward to some comments and feedback from the experts among you, and to sharing some practical and philosophical insights with everyone else. Get back to all right. Everyone should be back to our main screen in just a second. And with that, we're going to get ready. It looks like we do now have some steady participation. You'll see we have a full slate of presenters today from across the early childhood field. We'll introduce them each as they speak over the course of the next hour or so. And first, I am delighted to introduce Yasmina Vinci, Executive Director of the National Head Start Association.
Everybody, welcome. And this is really an exciting moment for us to have the most committed partners, the Early Care and Education Consortium, the National Association for Family Child Care, NAEYC, Child Care Aware, and our affiliate, the California Head Start Association, and then as many great presenters, people who have experience with the partnerships. Just a little background on partnerships. Since the very beginning of Early Head Start, partnership with family child care center-based has been a possible service delivery model. It has varied in terms of how much that was, the extent to which those models have been utilized in different parts of the country. In 2012, 2013, 67 early Head Start programs had family child care partnerships that served almost 2,000 early Head Start children, and 130 early Head Start had center-based child care partnerships with over 4,500 early Head Start children. So the models look very different. When we try to kind of systematize them, they look very different depending on, because they were designed by local communities, and so if they were urban, rural, tribal, migrant, seasonal, and so, or if they worked with populations with large immigrant or refugee populations. So there's a great variety and diversity in the models, which is a good thing, because that means that going forward there will be models and things to learn from to fit many different circumstances. The need is huge. This, you know, the whole hope of this partnership is that it will provide increased access to quality experiences for the youngest and most at-risk children. And the need is huge. Currently, the Child Care and Development Block Grant funding reaches only about 17% of eligible children, and then Early Head Start is funded to serve only 4% of infants and toddlers in poverty. So there is really this high need for high quality, affordable care for the youngest children, or babies as we call them. So there is good research also, which is going to be helpful on this, which found that more successful partnerships had really spent quite a long time, 6 months planning, that they had clear written agreements in place, they had processes established to prepare staff, and strong systems of communication. And I just want to alert everybody that just knowing sort of some of the structural things around this funding, that probably we could expect that all that needs to be telescoped, that the conversations about those partnerships and the agreements and so on, we need to be working, and communities need to be working on creating those right away. No, it's no, not much opportunity for waiting. Centers that partnered with Head Start, according to this research, also had higher quality settings, better outcomes for children, stronger family services. So in the most exciting thing, and the reason that we're all on the call, and thank you, there are about close to 500 of us on the call. In January 2013, President Obama declared his commitment to expand the early learning opportunities in his State of the Union, and he certainly has kept that idea of investing in it, and sort of put the money where his talk was. So in the January 2014, the 2014 appropriations bill approved by Congress, so the Congress also really is interested in this particular initiative, allocated $500 million for early Head Start expansion and the partnerships. In February 2015, the budget proposal for 2015 again included some more investments in those partnerships. So the Office of Head Start, the Office of Child Care, had a lot of information available about partnerships. They're doing webinars as well, and the funding opportunity announcement is expected early this spring, probably pretty early this spring.
Great, thank you, Yasmina. Next, I'm excited to welcome some of our other co-hosts to talk a little bit about what these new opportunities will mean for different groups within the early childhood education field. First, I'm pleased to introduce you to Barb Sawyer, the Director of Special Projects for the National Association for Family Child Care. Barb?
Thank you so much, Emily, and we are especially pleased to be part of the partnership looking at how we can make this work for families and children, and especially for family child care providers around the country. They have been telling us for quite a long time that they are very interested in working with Head Start programs and partnering, and not quite sure how to make that all happen. So it's particularly exciting for me that there is a family child care provider who will be speaking later, and also to see what a large group of people who identify with family child care from the first poll, what a large group there is on the call today. For those of you who aren't familiar with family child care, I want to give you just a little bit of background, because family child care is a slightly different environment, and it has a slightly different visibility in the communities very often. Family child care is provided in a caregiver's home for small groups of children. Usually if there's one caregiver, they can be licensed or regulated for up to 6 children. Sometimes with 2 caregivers, they can have between 12 and 14 children. These children typically are mixed ages. That's one of the very unique things about family child care, is that the children can range from birth through school age, and that is something that typically doesn't happen in other environments. The other thing about family child care is that it is much more difficult to identify as you're driving through a neighborhood, because typically providers don't have signs or any kind of advertisement that would let you know, other than a very large amount of equipment in some areas that providers you can see from the street. So it's sometimes difficult to identify where family child care providers are and to know how to reach them. Family child care around the country is regulated or licensed or certified by state or county agencies in some places. In some states, there is very little regulation. There are currently around 200,000 regulated family child care providers around the country. It is allowed as one of the formal options, obviously, for early Head Start, but it is also an option for Head Start programs that are interested in looking at working with other community organizations. So it is one of the options available for Head Start grantees. Most of you may know that Head Start is their that family child care is very often the choice that parents would like to make when they have that opportunity in their community, particularly for those infants and toddlers. And that's partly because it is more family-like. It looks like their home. It is in their neighborhood. It allows them to keep siblings together. For those families who may have non-traditional work schedules, sometimes family child care providers are able to be more flexible in their hours than other kinds of community child care programs are able to do. It's typically conveniently available either within the neighborhood where parents live or where they go to work, and so sometimes that's a choice for parents. That really is one of the driving factors. Family child care exists in every community across this country. Whether you're familiar with it or not, it's probably in your neighborhood, it's in your town, your village, your city. Family child care is across the country. So having an opportunity like this to become part of the Head Start, early Head Start system really brings some amazing opportunities to family child care providers, both for professional development themselves, but also for expanding services to some of the other families and children within their program. Because of some of the screenings, some of those things that will happen to every child in the program. And so we see that as an especially important advantage for family child care providers who are wanting and hoping to work with early Head Start programs around the country. Next slide, please, Emily. I want to tell you just a little bit about the National Association for Family Child Care. And what we do, we are the only national professional membership association that is specifically identified for the field of family and child care. So NAEYC really is the voice for the family child care field when we're talking about issues of professional development, quality improvement, public policy initiatives. NAEYC plays a very strong role within the provider community. In addition, as one of the resources that's available to communities around the country, we offer and administer an accreditation program that is specifically designed for the family child care field. The current model that we use was introduced to the field in 1998 and was designed only for family child care. It was not modified from a particular already existing tool, but was written specifically for the field of family child care. Family child care associations within NAEYC are working on an affiliate structure so that there is a little bit more conversation, networking opportunities, working together organizationally through an affiliate structure. Typically, there are local associations in states within a small community. Many states have state associations, which if you are considering looking at or expanding your current partnership, you might think about partnering with both the local and the state associations as an additional resource because they very often are working with providers in communities. Our headquarters is in Salt Lake City, Utah, and we are very, very excited about being part of the group that is looking at how we can bring this into the family child care community in a much larger way, how those services can be available, and how providers who are already offering high-quality programs, whether they're accredited, whether they're working in a state quality rating and improvement system, whether they're working on professional development, how we can ensure that those are the providers that as communities look at these partnerships, those are the providers that they really are working with, the providers who offer high quality care, because we know that really is one of the goals of this partnership is expanding the availability of high quality care for early Head Start children. Thank you again to the National Head Start Association and the other partners for the planning and for making this available, and we are looking forward to continuing to work with you.
Wonderful. Thank you, Barb.
Thanks, Emily.
Great. Next, I'm pleased to introduce Leanne Evans-Alvin, who is the Executive Director of the National Association for the Education of Young Children. Perhaps more familiar.
Thank you so much. It's great to be with all of you today, and we too are pleased to both partner with the National Head Start Association and to be part of this call. I apologize for my voice. I lost it yesterday, so I'm just working through that. But we're really also thrilled about this opportunity, both for providers, for child care providers, and particularly NAEYC accredited providers, the child care community, and also for the Head Start programs across the country. It's so exciting to have a funding opportunity that incentivizes collaboration because within our individual, while we have to think about our programs individually, families access programs across the board, and to think about our having to connect the dots better for families to have a seamless experience is really great. And I think, you know, one of the things I'd urge all of you who are considering this or thinking about partnering, this is a chance to think about both the role we have as providers in the early learning community in providing care to children while their parents work and keeping them safe while their parents work, and then also to capitalize on all the brain science that we know about how young kids learn in this window of opportunity to lay a social, emotional, a linguistic, a cognitive foundation for children before they enter school. And so when I think about a partnership between a Head Start and a child care center, it does both of those things, and kids can have a seamless experience, families can have a seamless experience throughout the day, make sure that they're safe and well cared for while their parents are working, and at the same time just maximize on the opportunities of learning. And so think about that as you're creating these partnerships. And next, please. And in that vein, I want to talk just for a couple of minutes about what NAEYC can do and what we're doing to help encourage this. For those of you not familiar with the National Association for the Education of Young Children, we are a membership association for the early learning field for professionals, for folks who are involved in early learning in a variety of ways. We have over 70,000 members. We also are an accrediting body, both for child care programs, and we have close to 7,000 accredited programs across the country. And then also for higher education, we accredit through ACADA. We accredit associate degree programs and then recognized programs, four-year baccalaureate degree programs as well. We also have a wide variety of publications and resources available, content for you as you're thinking about these partnerships. We have 10 early learning standards that undergird almost everything that we do, along with a number of resources around developmentally appropriate practice. And then opportunities to engage in professional development programs in a variety of ways, including our annual conference in November. And as I think about these partnerships, I really encourage you, for those of you, both in family child care and in Head Start programs, to reach out to accredited NAEYC programs as potential partners. And I say that because there's a lot of alignment already between accreditation standards, NAEYC accreditation standards, and Head Start standards. And so as you look at the language of these partnerships and what's going to be expected, a lot of it is around the alignment of those standards. It's around professional development that is very similar in what NAEYC requires. And so these programs across the country can be great partners to you as you're thinking about building these relationships. The other thing I would just point out and mention is that there's a lot of language in this, a lot of language in the partnership legislation around professional development and what needs to happen with professional development. And we've been engaged in a lot of work with state systems around what professional development systems should look like, how you break down barriers to professional development, if you've got to get, if teachers have to have access to additional either higher education or community-based professional development, how you go about doing that. And so I'd urge you to link into those initiatives as well. And then finally, much like the National Association for Family Child Care, we have an affiliate network across the country. We currently have 300 state and local affiliates, and you'll find all of our members are also members of their state and sometimes local affiliates. And so if you're looking to reach out to folks maybe who you're starting to collaborate for the first time, or thinking about maybe where to start, those affiliates could be a great resource to you in connecting to other local providers in your neighborhood and in your community, and to even be a place of networking where you can start to talk about what it takes. And the final thing I would just say to you is that collaborating, while easy to talk about, I know how hard it is to do the meaningful collaboration that it's going to take to make these partnerships successful. And so anything that we can do, either at the national level or at the state and local level, to facilitate that deliberate work of collaboration, to make sure that the dots are being connected and that the partnership and the collaboration is sustainable, is really important to us. And so we look forward to partnering with the National Head Start Association to make that a reality. Thanks so much again to Yasmina and NHSA for allowing us to be part of this call.
Wonderful, thank you. Great. Next, I'm pleased to introduce Chad Dunkley, who is the Chief Operating Officer at New Horizons Academy. And Chad, are you there?
Yes, thank you. And first, I just want to say on behalf of New Horizon Academy, we are Minnesota-based. We have 62 programs in Minnesota that are nationally accredited and have been doing this for over 40 years. And I got to tell you, there's a great deal of excitement back here about building partnerships where they didn't exist before, and we're thrilled. But I can also speak on behalf of, I'm also a board member for the Early Care and Education Consortium, representing about 8,200 centers throughout the 50 states. We care for a little over 1 million children a day in those programs. And this is the talk of many different states about in particular child care centers who have never partnered with Head Start, that this is a real opportunity to do that. And just a few comments on what's happened to centers over the last years. I know all of early childhood has really struggled with different parts of funding cuts and other things, in particular child care assistance cuts in the states because of state funding problems and a bad economy, low reimbursement rates, waiting lists, and other challenges, that there are many child care centers in this country who are located near the families we want to help, who are really struggling, who are barely making ends meet. It's very difficult to keep their doors open. They have empty, fully equipped classrooms that are ready to go, and they are very eager to partner. These new resources potentially could save those programs and keep infrastructure in the communities that need high-quality care the most. So this is a great time to look to the center-based community to partner. And like I said, we are eager. We have classrooms, and we're excited about the possibility. We also, I want to encourage, and I know Rian said the same thing, there are many very high-quality child care centers in this country. Wonderful, nationally accredited programs that are now meeting much higher requirements in states that have quality rating and improvement systems. And this money is on a fast track. We need to prove that these partnerships are going to be successful, that this money can start flowing this fall. And successful partnerships are happening, and children are in high-quality settings having high-quality experiences. So I recommend that as a Head Start grantee, if you're looking for partners, start searching. Who are the providers in your community that are already very committed to high quality? They're doing great things in the classroom. They are nationally accredited. They are committed to quality rating and improvement systems, because the owners of those programs, the operators of those programs, they are committed to quality. They want to do great things for young children. Let's help them do that. Let's help them be successful. Those are the operators. We want to stay. We want to thrive and exist in your community, even expand services to the children that need them most. So I encourage you to do that. I think many of those are part of the Early Care and Education Consortium, and I'm excited to say at the end of this call, Rachel, a staff member from the consortium, we've already begun looking at matchmaking opportunities. Of the 8,200 programs, we've asked who's ready to partner, who wants to partner, and we're going to try to help anyone that wants to partner match providers that have already said this is what they want to do. So we're excited about that. Let's make this new money successful so we have good arguments to grow these resources. If we don't get this money out and we don't get it in successful partnerships, quality classrooms with quality experiences, we won't get new money. And we all need to do this together. We need to be a team, and we need to make them successful. So we're thrilled about this and excited about the opportunity.
Great. Thank you so much, Chad. And next, I'm delighted to welcome as well Lynette from the Child Care Aware America to talk about child care resource and referral. Lynette? Lynette, are you ready? Lynette, can you hear me okay? I'm not sure if you muted yourself. All right. Hopefully Lynette just stepped away from her computer for a moment. Yes, I can see your message. Can you speak into your phone? All right, sorry for the technical glitch. Lynette? All right. Yeah. All right. Hopefully that'll. Okay. We can't hear you, Lynette. Do you want to try calling back in? We'll go ahead to the next slide, and then we'll come back to you after the next speaker. All right. Hopefully that'll work. We are excited to hear about what this means for child care resource and referral, and how they can be involved in different ways in the partnership. And before we get back to that, I'm excited to bring us into our next section of the presentation, where we'll hear from three different existing partnerships between early Head Start and child care folks. Oh, Lynette, are you there now? Okay, I can hear someone's line. All right, moving on. First, we'll hear from an Early Head Start and Family Child Care Partnership presented by Stacy Scarborough, who is the Early Head Start Director at Venice Family Clinic in California, who partners with Fannie Mell, the owner of Mell Family Daycare, also in California. Stacy and Fannie.
Thank you, Emily. And are going to have a very practical presentation because we are both very close to the work. So like Emily had said, we're in Los Angeles, California, and our grantee is a community health center with an Early Head Start program. And Fannie is here, and she can share. She is with her family daycare, which is accredited and licensed for 14. And she does serve the multi-age, like Barb was saying, 6 weeks to school age with 3 assistants. Next. Next slide. Okay. One of the questions we were asked is how does this model in this partnership meet the community needs? We put that it's meeting the needs of families that are working and in school, the home settings, which was talked about before, because siblings can be together. It also serves as a model to Early Head Start families that you can live in your own home or apartment and have your own business. And we have a lot of families that have recently moved to the United States, and I think it's very hopeful. And lots of families have this in their family partnership agreement, so I think that's a benefit that we have. We're able to provide longer hours than an Early Head Start program can afford alone. It meets the needs of infant and toddler care. We are serving less than 2% of the need in our community, and so this helps us meet that need. It also improves the quality of childcare, which we'll kind of talk about in a minute. And then families, just in the overall society goal, families can earn incomes, be protective in society with opportunities for work and education, and meet some of their own individual goals, maybe for furthering education, and then also for the program that we can meet some of our outcome goals for families being productive from being in the program through this partnership. Next. Okay. So one of the other questions that was asked of us is, what do we bring to that partnership? So I'll let Fannie kind of share what her business brings to the partnership, and then I can share next.
Like we said before, we have longer hours for care and flexibility. Home like setting for infants and toddlers. We have a staff that help us to do a job. A strong relationship with the families. We are small programs, and we can have the close to the families we know, and allow siblings to be raised together, process their own CICFP contract. We have the individual contract, opening their business to the most vulnerable children in each good role model to society. We have children with special needs, and this is needs in our community, as most housing situations are shared with no access to outside space for play. Family child care providers are a good transition for infants and toddlers to be ready for preschool and kindergarten in a home environment. It's not the stressful of the strict schedules. Lesson plans have been planned to reach individual goals in the child. We receive from Early Head Start professional advice and supporting children's development and observation. Family child care are a small program that permit build special relationship between parents and providers.
Sure. So from Early Head Start, what we can bring to this partnership in our model, and like was said earlier, every model is very different. but we do have a family advocate that's assigned to the family child care option to do the home visits, to do the parent conferences, screenings, and also help with the coordination with Part C services. The child care education manager coordinates the comprehensive services, doing the assessments, planning trainings for the staff, completing lessons plans in partnership with the family child care provider, and also helping with recruitment and enrollment. With those comprehensive services, we have a dietitian that reviews menus and the temperature logs monthly, provides nutrition training and consultation with the family child care homes that we contract with. And then we also have our mental health consultant that provides observations, trainings, and time for reflective supervision to meet with the staff and really talk about what is going on in that setting. And then we provide training and time for collaboration with all partners. We have a schedule where we schedule out trainings and then time for meetings. So that is what we bring to the partnership. Next. And then one of the fun question that was asked of us is lessons learned over time. And I feel like, we're always learning. I don't think, and that's just an attitude that we have to bring, but we are always learning because things are very different in a partnership. Family child care environments, and we're just going to be really honest, are hard to keep up with the performance standards. And so to do that, we just have to be really open to work in a progress attitude. We're doing the best we can every day, and we're going to get there, but we have to be really open to that. Supervision is really different in a family child care because there are no low walls. It's a home. There's walls. There's rooms. It's in a house, and so we really have to problem solve that, and that kind of goes back to the original point of how that's going to look. We've learned over time, toothbrushing in a home setting is a little bit different too. You don't have low sinks and you don't have multiple sinks. So how are you going to have multiple children go to the sink? What's a safe step stool to do the toothbrushing? Another thing is, HR issues are really different. It's not your staff, it's your partner. And so your feedback should really feel that way, and there's some urgency maybe from an early Head Start program in meeting a certain standard and having to fix that, and maybe you could say it a little bit differently with a staff member, but with a partner, it may not be their priority, and so how do you work through that? And I really feel like the staff that manages that has to have some training in how you do supervision with a partner because it's quite different. Enrollment with state subsidy in early Head Start is not easy. If you're going to, have multiple funding sources and braided, it's something that, each state looks at it differently, and it's something that has to work through. It's great to have somebody to collaborate with over tough cases. It's wonderful to call your provider when you know that you have for provider supervisions and observations with children. Many of us that are out there, you're really on your own, and so if you have a consultant that can go out and really work with helping, providers with challenging behaviors for those kids, it's really important, and we've learned, and it's never enough. Next. Because for us, family child care is a smaller option, children with the highest scores get into this option. So we're serving children and families with serious needs, and that kind of goes back to the original point of making sure there's enough support for those providers when they're working with these families. So we've learned over time that really a lot of kids with high needs get into this option. We've also learned, we're back in the practical part, really the medication administration policies that have to do with the performance standards, you need to have strong oversight, because it's not like you can walk down the hall and see what medication came in and was the form filled out. The minute medication comes in, your provider needs to call you. You need to go out, make sure everything's there. Is it stored in the proper way? And that's just something we've learned over time. And I think the biggest thing that we've really learned is that, when you're partnering and you're meeting those standards and meeting people's needs, is just really truly having respect, empathy, and an open attitude to feedback, and really faith in each other that we can meet the performance standards together, and we're going to get there. And everybody looks at it differently, and that's okay, but we're still going to get there. And I think, to me, that's been really the most important lesson that I've learned over time. And then, Fanny, I don't know if you want to add anything to close in that?
No, just say thank you, because the partnership is really good and help a lot family child care.
With NHSA and, of course, all of the other organizations participating today, as well as others that are thrilled as we are about the opportunities that the Early Head Start Child Care Partnerships afford. And we are thrilled to be able to participate in a venue such as this to share with others who are wanting to not only discuss our shared enthusiasms, but also provide, as was evidenced by the presenter that the presenters that just shared, that this is a real opportunity for families and for children to expand high-quality early learning settings across the country. For those of you who are unfamiliar, Child Care Aware of America is a national nonprofit membership organization. We were formerly called NACRA, or the National Association for Child Care Resource and Referral. And our mission is to promote policies and partnerships to ensure access to quality child care and early learning services, and to provide vision, leadership, and support to the nationwide network of child care resource and referral agencies. So I wanted to just spend my couple of minutes sharing a bit about how communities and organizations across the country can leverage their relationships with and through child care resource and referral and their approach to the Early Head Start child care opportunity. Many child care resource and referrals across the country both do direct service and planning within communities and with families to ensure that their children arrive ready to learn in kindergarten and certainly beyond. Child care resource and referral agencies help create child care solutions, and you can see on your screen the number of child care resource and referrals. Almost 80% conduct community needs assessments for their communities. Just about 60% administer child care subsidies for their states, and about 62% analyze and report on child care supply and demand. So as was shared earlier, in getting to know your community, understanding your child care providers and your child care services available in your local states and communities, child care resource and referral agencies can be very helpful in trying to support you in identifying what the needs may be in your communities. And again, next slide, thank you, Emily. And again, as we think about supporting learning and sharing resources, providing technical assistance, and highlighting best practices and partnerships, the child care resource and referral agencies can contribute in these kinds of ways with the expertise that they've had over the years in providing training, technical assistance, and professional development opportunities in their states and their local communities. I think it was Rian who mentioned earlier that meaningful collaboration is sometimes a challenge, and leveraging relationships that was just shared in the prior presentation with your child care provider, family child care home, and other organizations is going to be so critical for collective success. And as a national organization, we look forward to continuing to provide information and resources and model at the national level through our collaboration and partnership with our national partner organizations, and providing information in venues like this and acting as a resource for communities and states as they pull together their approaches. Again, thank you so much. Apologies for the misstep on the audio. And we, again, are thrilled not only about participating today, but thinking together about how we can support effective early head start child care partnerships into the future. Thanks, Emily.
Wonderful, thank you.
All right, our next we'll go to our second presentation. We've got two more to go. From Linda Meredith, who is the Chief Operating Officer for the Community Partnership for Child Development in Colorado. She'll be the only one speaking today, but you can see a number of her partners across center-based family child care home and home visiting partnerships that have contributed to the presentation. Linda?
Thank you, Emily, and thank you for allowing us to be a part of this. As Emily said, our partners, I developed the presentation in partnership with all of our partners. However, none of them were able to be here today. And so I am going to be focusing on the fact that on our center-based partners, but we do also have a long partnership with family child care. Our Early Head Start with Child Care Partnership was established in 2000 with Early Connections Learning Centers. At the time, Early Connections had eliminated all their infant-toddler programming because of the cost of doing infant and toddler care. And so we were able to bring in our resources and reestablish that. There was a teen parent program that existed at an alternative high school called Tesla, and it has since moved to a different location. And they also were eliminating their infant and toddler programming due to costs. And so we were able to partner with them and actually resurrect those programs. And while I won't be focusing on it, we also have Early Head Start and family child care homes via the Early Connections Learning Centers, and they are the home base for the home network of the Pikes Peak region. And so historically, what our community need is, our community assessment forever has shown that there is a lack of infant-toddler care, regardless of a family's ability to pay and regardless of quality. And so through these partners, we were able to add an additional 70 slots in our community for low-income families. Next slide, please.
Great. I'm going to click it in 1 second. Just a very brief warning in case there's some kind of emergency. The power in Alexandria is flickering because we're about to have a thunder and lightning storm. So if for any reason the webinar terminates, we will start again as quickly as we can get ourselves set up. There you go.
That's funny. Okay. And what each partner brings to this is our partners bring the knowledge and the infrastructure for full-day services. They were already, as previous people have mentioned, they're already high-quality programs. They were just struggling with just the cost of providing the care. And CPCD was able to bring the additional resources to provide increased quality for all children at each site. And each one of our partners identifies that as one of the key benefits of being a partner, is that for not just the children served in the Early Head Start slots, if you will, all of the children in the programs benefit from the Early Head Start being there. CPCD provides the family advocacy. We provide the nurse support so that families are supported in getting their medical and dental needs met and identifying their medical and dental homes. We provide the behavioral health supports, and then the staff in these programs can access any of the trainings that are available to CPCD staff, and we also offer them access to our tuition assistance program. And they all have expressed that that has been a huge, huge benefit for them. Next slide, please. We've learned a ton of lessons in the last 14 years. The biggest benefit is that the blended funding increases quality. The programs all have a base source of funding, and then the Early Head Start dollars and other supports, the staff supports and those kinds of things, increase the quality, and it's available to all children that are served in those settings. There is a difficulty hiring and retaining staff that meets both the Head Start performance standards and licensing for infants and toddlers in the state of Colorado. Here locally, Colorado is a home rule state, and the Child Care Assistance Program is probably the biggest challenge that we face, in that families that are Head Start eligible generally are not eligible for the Child Care Assistance Program because they're not involved in what are considered eligible activities, and those parents who are working are generally over 100% of the federal poverty level. And to even access and stay eligible in our program or in our community, you need to be at 135% of federal poverty. We did learn that making sure all agency staff are sharing the same message. At the very beginning of our partnership, we had every person going into each classroom setting or center setting, and a child development coordinator might say something different than the family advocate, who might say something different than the nurse. And it was very confusing at the very beginning. Meeting the Head Start performance standards is challenging, But the biggest concern that the center-based folks had was that needing the one teacher for every 4 infants in care was one of the biggest challenges. And interestingly enough, the crib spacing, our state licensing requirements are only 2 feet apart for the cribs, and having the space to put cribs 3 feet apart has been kind of an interesting little challenge that we faced for the entire time. And my last bullet here is that all partners have been through several reviews and feel the same stress. We have a federal review scheduled in 3 weeks, and so right now we're making sure the cribs are 3 feet apart. So, and I think that's all that I had.
Great. Well, thank you very much for sharing your experience. We appreciate you getting on. Next, we will hear, let me click through, from a slightly different family child care model that exists in Early Head Start. A little bit less common, but also interesting, and in some communities, the thing that best meets the community needs. And so I'm pleased to introduce Genevieve Agano, who is the Early Head Start Director for Lutheran Services Family Child Care Homes in Florida.
Good afternoon to all attendees. Next slide, please. Thank you so much, NHSA and Emily, for allowing me to share our program. As one of the delegates for the Hillsborough County Board of County Commissioners, Tampa, Florida, Early Head Start Family Child Care Homes. Next slide, please. A little background. Early Head Start Family Child Care. In 2010, we became one of 22 demonstration projects who received the ARA funding to establish family child care homes. We had 30 licensed family child care homes, 30 child care providers. We served 120 children from 6 weeks to 3 years of age. Hillsborough County was one of the largest providers in the ARA funding. We also have another delegate, and that is the YMCA, which has 80 children with 20 child care family homes. Next slide, please. Some of you might not be familiar, so I've taken the liberty to provide some definitions. Family child care is care and education provided to children in a private home. Head Start Family Child Care is Head Start and Early Head Start comprehensive services that are provided to a small group of children through their enrollment in family child care. Family child care program option is Head Start and Early Head Start, and child care services provided to children primarily in the home of a family child care provider who is licensed by the state and set aside specifically for the purpose of providing family child care. Our child development education specialists must have an AA in child development or early childhood education with experience in early childhood development, family services, knowledge about the CDA, and Head Start performance standards. Next slide, please. Our family child care options. Next slide. Our model, design, and oversight. Child Development Education Specialist is hired and assigned a caseload of 15 providers. The Child Development Specialist visits providers at least monthly, depending on their needs. They also provide support, coaching, technical assistance, mentoring, and monitoring. Our monitoring tools include the Head Start Performance Standards, Family Child Care Rating Scale, our Safety Checklist, Child Outcomes, Family Child Care Creative Curriculum. The CDA Specialist tracks needs, strengths, develop plans, conduct on-site reports, and monitors license compliance. Enforcement actions or revoked license certification will be automatically terminated. And this is outlined in a contract. They received a 15-page contract which explains what is expected of them and what is expected of us from Lutheran Services Florida. Next slide, please. As you can see, we have 4 little ones sitting here, and as everyone has said, family child care is different. Lots of outdoor space where activities are also done in addition to the homes. Next slide, please. Training for providers. Family child care providers serve the function of a teacher. Although their employment relationship with Lutheran Services Florida Early Head Start is different since they are on a contractual relationship. Family child care providers must meet ongoing professional development requirements. They participate in monthly LSF, Early Head Start regular scheduled trainings, and are mandatory for all pertinent topics. Other trainings will be completed, such as one-on-one and during our Family Child Care Network meetings. Parent communication. Providers communicate with parents, staff, and participating early intervention agency staff about each child's developmental progress. Communication with parents occurs through daily toddlergrams, at least 2 parent conferences, home visitation, individual educational plans, transition, and relevant telephone conversation. We are so looking forward to expanding our Early Head Start family child care homes in Hillsborough County. Thank you so much for allowing me to participate on the panel.
Wonderful. Thank you, Gino. And there we've got some little guys stacking I don't know what they're building, but I'm sure that they do. Next, we're going to take just a few minutes. I know we're coming up on 2 o'clock, and we do want to have some time for questions at the end, but we want to quickly talk to you about some next steps and what you can really be doing over the next couple weeks, the next couple months in your community to begin the work ahead. First, we're going to be joined by Rick Mockler of the California Head Start Association. Rick? Rick, are you there? Oh, hang on. You're muted. There you go.
Thanks, Emily. As we've been looking at this issue with NHSA, what's really clear is that if a program waits to start planning their partnership until the funding opportunity announcement comes out, it's too late. We know that we don't know exactly how much time folks will have to write their proposals, but what OHS is telling us is that it'll certainly be within the the allowed span of 45 to 90 days, and probably less than 90 days, which you need all of that time just to write the thing. What we really know from experience is that the most successful partnerships are the ones where there's been thorough understanding and there's been thorough planning done in advance. So now, the takeaway really is that now is the time to identify prospective partners, and for both you and the partner to conduct your own due diligence so that both sides understand what is the expectation, so that a potential partner actually understands what's involved with the standards, the Head Start standards, and you've had a chance to review what kind of agreements and expectations you would have. So really, we know that OHS is moving as quickly as they can to release their funding opportunity announcement, that it'll be this spring, and they're hoping to have it sooner rather than later. So we really do encourage folks to get out there and identify and talk with prospective partners as soon as you possibly can.
Thanks. Barb, did you want to say a few more words on accessing networks?
On networks, or specifically on family child care, or how we can connect? I'm not clear what you're asking, Emily. Sorry.
Sorry. In the agenda, did you want to talk a little bit about using the national and state accreditation networks?
I think one of the things that we would strongly encourage as you're talking about partnerships with family child care, and as Rian and others said, talking about partnerships no matter what environment you're looking at accredited programs really gives you an incentive for providers to work with you, as well as a way to identify that they're already meeting many of those program performance standards with the alignments. All of the accreditation systems very much look at issues of quality, so I think that may be one of the things to think about. Part of what NAFCC can do with potential partnership conversation is to help put you in touch with both associations, and depending on where you are, there are not accredited providers readily available in every community across the country, but there are groups and pockets of providers in many communities. That is one of the ways that we could help potential partnerships in communities and in states, is to help put you in touch with family child care associations. The other thing I will mention that NAFCC is working on currently is a readiness, for lack of a better description, a readiness tool to help people identify for providers who may not necessarily already be accredited, to help programs, especially early Head Start programs and partnerships, give them a way to identify where a particular provider might be on a scale. And if they're not accredited, how close are they to being ready to work with your quality improvement folks and your professional development people to see what kinds of changes might need to be made. What is it that has to happen to bring providers to a level that you feel like they would be able to meet the program performance standards? So that is something that we are hoping to have available at least before our conference in July in Orlando, but hopefully we expect to have that possibly even in the next 6 weeks.
Wonderful. Thanks, Barb.
Sure. Thank you.
Next, we'll hear from Rachel Dema from the Early Care and Education Consortium about a little more on how to find programs locally to work with. Rachel?
Hi, thanks, Emily. Yeah, thanks for inviting the Early Care and Education Consortium to just jump back on quickly at the end of the webinar to talk about our matchmaking process briefly. This is a strategy that we've implemented in order to support and develop those connections and collaborations between early Head Start and Head Start grantees and center-based community providers that can potentially take shape and move forward as new partnerships within the initiative. So as Chad mentioned at the beginning of our webinar here at ECEC, we know that partners that are partner-ready and high-performing community providers will play an essential role in making the partnerships a success and increasing access to high-quality services among low-income infants and toddlers and their families. And our membership is made up of both nonprofit and tax-paying community center-based providers who are partner-ready, and that means they demonstrate that high quality of their infant and toddler services through status and state quality rating and improvement systems, as well as nationally accredited systems. So, and as Chad mentioned as well, they also have at the ready high quality facility space, as well as effective business models, professional development resources, and relationships within communities that have already been developed. So in order to match these ECEC providers that have expressed an interest in taking part in the partnerships with potential early Head Start and Head Start, as well as community action agency programs in their communities as potential partners, we've taken the step to cross-reference our own membership database with the Office of Head Start's databases and have generated letters of introduction between these various providers based on interest from our members. So actually, since we've submitted this slide, we've increased our matchmaking participants to actually over 600 programs with the recent addition of our YMCAs across the country who've expressed an interest. So interest and excitement are high out in the communities. We'd like to take this opportunity to put a call out to any early Head Start and Head Start grantees that are interested in connecting with one of ECEC's high-quality community center-based provider programs, we'd be happy to get in touch with you through Emily and NHSA. And we're looking forward to continuing to support the development of these relationships as the release of the FOA and the application process move forward. We have a toolkit that we're developing that will be available to the partners through ECEC, as well as ongoing technical assistance and support through the application process. So we're very excited to watch these partnerships take place and do everything we can to support them.
Great. Thank you so much, Rachel. Before we turn over to our last few comments and questions, I just wanted to share with you a few places you can go for more information after this webinar if you still have questions. The first is a website NHSA has recently built that has a lot of background documents from all over the internet, resources from all over the place, planning tools, carefully curated research, and planning documents to help you think through what you're working on. I'm also listing there three really links from the Administration of Children, should have been the Administration for Children and Families, which is the division within the Federal Department of Health and Human Services that oversees both the Office of Head Start and the Office of Child Care. The Office of Head Start will actually be administering the funds, but the Office of Head Start, the Office of Child Care, and the Administration of Children and Families have all created resources to help programs consider what resources there are, what Early Head Start entails, what partnership entails. You'll see two links here. One, the first gives an overview. The second is a list of their upcoming webinars about implementing Early Head Start. And then a link underneath that to the Office of Head Start's Early Childhood Learning and Knowledge Center, which has very rich resources about different partnership models, about the Early Head Start standards, the Early Head Start monitoring system, resources for practice around infants and toddlers, around cultural and linguistic experiences for children that match their families. Really every division of Head Start practice. And then just one more shout out, we'll be having a track at our annual conference in a couple months that touches on this as well. I'll leave that up for a minute while we get into any final comments. Yasmina, do you want to say anything before we, or anyone else on the line?
Let's get to the questions.
Okay. All right, we're going to move on to questions because we do have a limited amount of time, and then we'll make some final comments at the end. Sorry, I'm going to try and look here. I'm going to look through the comments while we're going, and I'll answer some of them and throw some of them to other folks on the call. Sorry, my computer is having fun. So here's an example. Do Early Head Start children pay for full-day child care spots when in child care center all day? Linda, do you want to take that one and explain how you do it?
Yeah, I'd be happy to. Yes, they do. The child care subsidy, or there is a sliding scale that the partners agree to create so that the families are not, children are generally there enough time that they will get a full day reimbursement if the family does qualify for a subsidy through the child care assistance program. But otherwise, families do pay, and then if the child care assistance program requires a copay or whatever, that's a relationship between the family and the child care provider. But for the Head Start part of the day, there is no charge.
Great, thank you. Here's a question: are they required to have the parent counsel if the family child care home only has 2 or 3 children? I know that that's handled a little bit differently in different settings, but do we still have Stacy on the line? Do you want to talk about how you do the parent counsel for a family child care home?
Yes. For the policy council and for the parent committee, so the families that participate in the family child care option, they have their own parent committee where they come together and meet and have topics and training. And then in our bylaws of the policy council, there are representatives on the Policy Council from the Family Child Care option, and it's interesting because it is the smallest option we have, but this year our president and both our vice president are from the Family Child Care option. So yes, they're definitely represented, and you decide that within your Policy Council bylaws.
Thanks. Here's a question that any of you can take. Can early Head Start funds be used to raise quality in a child care program, such as improving salaries, fringe materials, et cetera, in order to attract and retain staff? And
this is Linda, and the short answer, yes. That is a part of the contractual agreement that we do have with our center-based partner, that the financial contribution that we make to them should be used for materials, for salaries, for whatever they need in order to increase the quality.
Someone asked, is there any update on when the request for proposals will be issued and the timeline between the issue and the application deadline? The Office of Head Start has not yet released a final date. In Head Start, we refer to it as a funding opportunity announcement. If you're used to the term RFP or request for proposals, it really means the same thing. At this point, we keep hearing spring and early spring, and that it is likely to be a little bit less than the 90-day window, but there's no final word on that from the administration yet. One thing to note is that if you don't already and you plan to apply, you should go to grants.gov, because it can be a several-week process to set up an account to apply for a grant. So not something to be left until the night before the grant applications are due. Several more questions about access to the recording of this and also to the slides, and yes, we will share those on the Early Head Start childcare.nhsa website, and also we'll share the link with everyone participating and with the other organizations. A good question for Stacy. How do family child care providers meet the requirement of transitioning Early Head Start children for regular Head Start or some other type of preschool program?
So we have a transition process and a procedure, and so the family advocate will start working with those families at age 2.5, and we start with a transition checklist of working through, meeting the standards and the performance standards of those transitions, and then looking at other options for those children to transition. Now, one of the beautiful benefits of transitioning in family child care is that they could continue to transition to that home through the state subsidy program, where they would pick up children, ages 3 to 5. So they may be able to stay there, which would allow those families that continuity and those children's continuity of care. But really, we follow our transition procedures and protocols within the program, starting at 2.5 and looking at, what's the next best placement for that child and family.
Thank you. Another question, something we didn't get to in the content in this webinar, is that the question refers to when the budget came out that allocated the funds for these partnerships. It included a line about how partnerships wouldn't be observed for monitoring purposes during the first 18 months. And so the question is, to those of you who are talking today, thinking about that timeline, does that seem, based on your experience, how do you feel about that kind of a timeline to get a partnership ready for monitoring? Or what's your typical startup timeline?
Jurgen Lutheran Services, I support that wholeheartedly.
3 months will be really important.
Thanks. Children who are not low income. Our program still provide early Head Start services for children who are over income.
Be over income. We might have primarily
the outside the classroom home visits or the other services provided. They would still be affected by changes that happen within the classroom, such as a teacher who achieves a higher level of certification, or facilities that are able to be improved because of the Early Head Start dollars. Does that sound right to those of you who are practitioners on the call?
Yes. Yeah, that's exactly the case, and it's actually one of the benefits is that by having a couple of children that are in the classroom that are eligible for Head Start and receiving those services, all of the children in that classroom, and in our case, throughout the center, benefit from the extra supports. And so, and you can allocate some of your 10% over income slots to those centers as well.
Another question about who can apply for the Early Head Start Partnership Grant. Is it current Early Head Start programs the only ones able to apply, or can others? Anyone who is currently able to apply for an Early Head Start grant is eligible to apply for these grants. That includes any nonprofit or for-profit organization that serves children and can demonstrate their capacity for this, existing Early Head Start and Head Start grantees. States have the ability to apply. And really something that we've heard said when the administration talks about this is that really the strongest applications will come from communities that have worked together to figure out how they can use these funds to deepen their community resources for early care and education. And that's part of why we're so glad to have folks from all these different communities on today, and really encourage you to reach out within your local communities using the tools that exist, using existing relationships, and find ways to think together about how this can be developed. I'm just scanning the questions. This is an interesting one. Yasmina, this may be relevant for you. It asks, what is the top priority of this funding opportunity? Is it to expand the number of children in high-quality child care, or is it to improve less quality programs? Both seem very applicable.
Yes. Yes. It started as having a dual mission. One is to increase access, increase the number of children in better care, in good care, and the other one is to make sure that the quality of the settings they're in is good as well. So it's both.
Yes. A question about what types of standards partners would have to meet. Partnerships at this point are expected to meet all the Early Head Start standards, which are on the eClick website, which is the fourth link down on your screen. You can read all of the standards all the way through. They are very comprehensive, but have led to some very high-quality settings across the country. And certainly the Early Head Start program is intended to be a resource in meeting them.
This is why partnering is good, because Early Head Start programs sort of know what to make of it. Because otherwise the reading is pretty overwhelming, an interpretation of it. And some of them know how to apply those. In fact, there are things I understand from the group of practitioners, there are workarounds around some of them where they get met, where the standard gets met, but not in the way that it sounds. Things like having to do with the ratios and group sizes. I know there have been some creative solutions.
And it's certainly true. I know we heard folks mention it earlier in the webinar that many high-quality providers are already meeting state licensing and meeting NAEYC accreditation standards and others, and NAEYC accreditation, are practicing a lot of the best practices that we know are true across all different types of early learning settings. But interpreting them through the Head Start standards can be difficult to start with without a strong partner. Another question asks, can programs apply for a combination model, meaning a mix of home visiting and days in child care? At this point, the administration has really been focused on center-based care as a way of supporting working families, in part because their investments in the maternal, infant, and early childhood home visiting program are also a priority, are a separate stream for home visiting funds. So it's not clear that there will be a priority for home visiting models when these new funds come out. But that said, if it best fits your community, I have no final word for you on whether or not you should put that in your grant. Someone asked, where would you actually start to apply for a partnership? We've heard from a number of different groups today about how you can find listings of their accredited programs. You can go to all the different websites to find those. You can also go to the eClick website, the Office of Head Start website, and put your zip code into their map and find your local early Head Start provider very quickly. It looks like a lot of our other questions are pretty particular to people's individual experience or similar to questions we've already answered.
Emily,
yeah.
I also thought I might mention in the Family Child Care Options final rule, which was effective February the 7th, 2008, those who are interested in providing family child care might want to take a look at that prior to submitting their grant proposals.
Thanks. And so one last logistical question I'll answer, and then we'll take some final comments from our speakers. Someone asked, so if I find someone to partner with, does the partner write the grant, or do I have to write one also? No, there would be one grant coming from your community, and I think ideally you'd both be involved in the narrative and describing how the partnership would work and how it would be implemented. With that, Yasmina or any of our partners on the line, any last comments?
I think there will be a lot of learning together that will go on in the next few months, and I think I'm again grateful to everybody for really wanting to make this opportunity a real success in implementation. So we are looking forward to working with everyone who wants to work on it, and thank you all for attending this webinar.
All right. Hearing no other comments, that's all we have for today.